So are you or someone you know, are you dealing with a chronic lower back pain problem? You've likely heard of the traditional treatment options, pain medications, steroid injections, or even sometimes back surgery.
But you know what? There's another option out there, and Dr. Chad Shaw is a chiropractor at the Soleve Center of Jacksonville. Thank you so much for being here.
Well, thank you for having me.
Absolutely. So let's talk about this. There's a lot of treatments that are out there, and usually, doctors tend to, unfortunately, go to the steroid injections. They tend to go to, back surgeries and so on and so forth. But with Soleve, there's a whole new option out there.
There is, and back pain is complicated, and there are a lot of treatments out there which confuse people. The nice thing about Soleve, it's non-invasive, so we don't have to worry about the risks that are associated with drugs and surgery and steroid injections. The other nice thing about Soleve is that it's targeted neurostimulation. So what that means is the Soleve device actually creates a computerized map of your spine and of your back and locates the painful tissues.
Wow. And
then does a targeted stimulation to those tissues.
So kind of walk us through how it works. I mean, you gave us kind of an overview as we're taking a look at some pictures there. Are you actually putting something on the skin? And okay, there you go. That's an even better picture. Is that painful? I mean, what are people experiencing, and what is that machine actually doing?
Well, for the patients, it couldn't be any easier. They basically come in and lay down for 30 minutes. And the initial part of the scan, the device scans it scans the tissues in the lower back. It gently presses into the tissues. A lot of people describe this as a feeling of like a plastic comb pushing into your back.
Okay, so like next to nothing.
Right, so
wow.
it gently touches the skin but doesn't penetrate it. Mm-hmm. During the actual procedure, when the points are being treated, it sends a soothing but highly concentrated electrical impulse into the tissues, which then releases the body's natural painkillers.
I've used other things like this, but not as precise as that in therapy for recuperating in certain things, which has worked really well. I can imagine that with this, because it's so pinpoint accurate, it finds out exactly where the area is, that it's doing an amazing job.
Well, this is an evolution of that therapy you've probably had. Yeah, and it's targeted. It identifies those tissues, and then that way we can treat them.
How many treatments? I know it varies probably according to what kind of pain they're going through, but how many typically how many treatments does somebody go through before they see the results?
Well, sometimes we have patients that come in, and after one treatment they tell me they have great relief. But we base our treatment plan on a protocol that was designed in a controlled study, and they had 2 treatments a week for 3 weeks, so a total of 6 treatments. And the reason we chose that protocol was because they had a 95% positive success rate.
95%.
Wow.
Yeah.
Wow.
Alleviating the pain. Who, if someone's watching right now, who would be eligible for this? And what if somebody has already had a back surgery? Does that have any implications on whether or not they can do this kind of treatment?
People that have had back surgery that still have pain, those people are very frustrated. And
sure, I can imagine.
Yeah, I mean, they think they've done everything they can, and they haven't. Soleve can treat people that have had back surgery that continue to have pain.
Beyond that, who are the other people might be, because I always talk about my poor dad. I always bring him into the conversation, but he's always struggled with lower back pain. Is this someone, if they just have reoccurring chronic aches in the lower part of their back, is this something that would be ideal for them?
The patients that come into my office have typically lost something. They've lost the ability to go to work.
Wow.
They've lost the ability to lift their grandchildren. They've lost the ability to garden. And if you've got a back pain that's limiting your life, that's taking away from your life, you need to come in and see if you're a candidate. And we do a thorough consultation and evaluation to determine if you're going to be successful with this.
And this is FDA approved.
It's FDA approved, it's safe, no side effects.
Any success stories that you could share real quick?
Yeah, we've got a lot of success stories. I'd probably direct, my patients can tell it better than I can. I'd probably direct them to our website, SoleveJax.com, and you'll see some video testimony from patients, from my patients, from other patients that have used Soleve.
I can only imagine, like, having to live with something like that and endure it, and then to be able to get relief from that pain must be very liberating for your patients.
Oh yeah, absolutely, getting their life back.
That's right, that's what it's all about. Thank you so much, Dr. Shaw. We appreciate you being here, and thanks so much to the Soleve Center of Jacksonville for coming on and sponsoring this segment.
To learn more about your treatment options at SoleveJax.com, or you can call them at 904-394-5006.